So in this lecture, we're going to talk about substance-related disorders. And when we talk about substance-related disorders, there are it's a broad category, right? So we talk about depressants, we talk about stimulants, we talk about hallucinogens. We'll even talk about different kinds of poly substance abuse, right? Where people mix things. And then we'll talk about cannabis, which is, it kind of stands on its own in many ways because it doesn't have a singular property. But if I were to use the word substance abuse or even the word drug, let's start with the word drug. When you hear the word drug, what comes to mind?
Death.
Death, right? So the abuse of drugs can lead to overdose and can lead to death, certainly. George?
Yeah, I said addiction.
Addiction, right? So the idea of becoming dependent on the substance. And when we talk about substance use disorders, there is the elements of dependence and abuse, right, which drives the addiction, right? Eileen said thinking of addiction as something negative. But what about the word drug? What is a drug? Abigail, can you explain that?
Like when I hear drugs, I think of like a pharmacist like prescribing like some form of like medication.
Mm-hmm. So how about cocaine?
Well, no, like that would I was when I think of like something like cocaine, I think maybe more of like a street drug, like something that's like obviously like illegal, like be sold and people get clearly addicted to it more often.
Okay, how about alcohol?
Oh,
What do you- yeah, I'm going having a little bit of a give and take.
oh, like what do I think of alcohol?
Yeah,
Like,
is alcohol a drug?
yeah, because it's also addiction. Like people could obviously also get addicted to alcohol.
Right. So when you think of the word drug, it isn't always a prescribed medication. There are different kinds of drugs. There are drugs that are legal without prescription. There are drugs that are legal only with a prescription. And then there are drugs that are illegal or illicit in all contexts, right? So I want to broaden the word drug, right? Um, to all facets, things like tobacco. Tobacco is it's a drug. Now, what isn't a drug? Food, right? So when we talk about the definition of a drug, it's any substance other than food that can alter our mental states, our mind and bodies, right? It does not need to be medicine. It does not need to be illegal. The reason why we default to medicine or illegal is because that's how historically it's been used. But drugs can be things that are legal without a prescription as well. So if you want to know why we talk about substances of abuse or substance dependence, right? We refer to it as a substance to include the things that you may not even think of as drugs. So alcohol products, it's a drug. Tobacco is a drug. Caffeine, now you're like, well, wait a minute, caffeine, it can be used as food as well, but it does have non-nutritional value. So caffeine gets put in that drug category as well. So we have to think about things pretty broadly. Now, when a person ingests a drug, they experience intoxication, right? So intoxication is a temporary period of time where it alters one's thoughts, emotions, or behaviors, right? So that's very important to understand. The drug influences how we think. The drug influences our emotions or our behaviors. So if we were to think of something like ecstasy or Molly, right? That's a drug. And people report having heightened connection and very strong emotions under the influence of ecstasy or Molly. Alcohol can impact the way we think, our judgment. It can impact our behaviors and so forth. And all of the drugs can impact all three, the truth is. But I'm just giving you an example of a drug and how it could impact one. Now, there are certain drugs that their intoxication properties can induce hallucinations. The term we use for that is hallucinosis. So when you think of hallucinosis, what drugs come to mind? What drugs are going to likely lead to hallucinations?
Marijuana.
LSD, someone said shrooms, someone said marijuana. Are there any other drugs that could do so?
Psilocybin.
That is shrooms. PCP, right? Sure. There we go. I was waiting for a drug that's not in the hallucinogen family that can also lead to hallucinations. And Jessica and Julia put it in a chat, cocaine. Cocaine is an interesting drug because it targets the dopamine receptor, and cocaine floods the system with dopamine. And we know excessive amounts of dopamine is linked to hallucinations, right? So one of the arguments or hypotheses about schizophrenia is the dopamine hypothesis. So if you pump the system with excessive amounts of cocaine, you could also have psychotic states or hallucinations. So why I like the answer of cannabis and why I like the answer of cocaine is these are not your traditional hallucinogens, but a person can have distorted sensations and perceptions, which we'll talk about. So do we feel like we have a better understanding of what a drug is, what a drug is not? So if we have intoxication, which is the experience under the influence of a drug, what happens when we're no longer under the influence of the drug? Anyone know what that's called? Withdrawal. Yeah. So withdrawal is what happens when a person is coming off the drug. So whatever the experience is during the usage of the drug, we oftentimes get what's called a rebound effect, which is the opposite experience. So let's take cocaine because that's the last thing we talked about. Under the influence of cocaine, there is a heightened state of euphoria, energy, alertness. It's a stimulant, right? But during withdrawal, you have what's called a depressive crash. So it's the opposite, whereas you went from being alert and not needing sleep to crashing and feeling it's hard to even wake up, right? So withdrawal is when a person comes off. Now, taking a person off a drug is also pretty tricky because some drugs you can stop cold turkey and there's no serious consequence, but other drugs can cause potential seizures and even death. And I'll give you an example of one you may not always think of: alcohol. When a person ingests alcohol and they drink alcohol long term, it is possible for a person to develop what's called delirium tremens, right? Which are shakes and tremors and sometimes bizarre perceptions, which can be fatal. So when we detox and a person goes through a withdrawal, sometimes it's cold turkey, sometimes it's a gradual process, right? So Eileen talked about with alcohol, people can have the shakes, they might throw up, they might have sweats, they might have difficulty sleeping, bizarre dreams, and heart related abnormalities. Yeah, so you're basically describing why, if you're going to take someone off alcohol, you have to do it gradually. So when we talk about the word abuse, abuse, I want you to look at the word itself and treat it as two words: use. So when you see a prefix ab, ab, what does that mean to you?
Like
So,
it's
yeah. Go ahead, George. I'm sorry.
like it's not normal.
Not normal. So it's a non-normal usage, right? So what is substance abuse? Well, substance abuse is when a person uses a drug other than it's intended. Now, that's very important when we're talking about prescription based drugs. So a person who is prescribed something like Xanax. Xanax is a benzodiazepine. It helps with anxiety. It's used for breakthrough anxiety. If on the pill bottle it says, take once a day in the morning, one pill, and the person decides that they're going to take this, one pill's great, but I think I need two pills. Now they're using a higher dose than is prescribed, and that would be considered substance abuse, right? It's an abnormal usage. When it comes to street drugs, we refer to any amount of usage as substance abuse, right? So any amount of heroin is considered substance abuse. Any amount of cocaine is considered substance abuse, right? So it's an abnormal usage. Now, so by definition, your book tries to break it down in a different way. So I'll also give you that, but it's a pattern of behavior where a person starts to rely on a drug in an excessive manner, right? And one of the problems with substance abuse is that it causes impaired relationships, affects one's work performance, and can put people in danger of self-harm and other harm, right? So when we think about putting yourself in harm's way, yeah, you have the risk of overdose. But when you drive under the influence, you're also putting other people in harm's way. Now, that's abuse. Dependence, which we have historically talked about as addiction, so that's really substance dependence. Now the person has shifted to, quote unquote, needing the drug in order to perform basic aspects of life. So a person who is very dependent on cannabis might say, I need to wake and bake, so to speak. Wake up, have a joint before I start my day to put myself in the right headspace. Well, that's substance dependence, right? If you can't start your day in the absence of smoking a joint, then we have a problem, right? So it's clear that there is some level of dependency there. Now, we also, related to dependence, we see the issue of tolerance. Long-term usage of a drug is going to result in tolerance. And there are two ways to describe tolerance, right? So tolerance is needing higher doses to experience a previous high, or when a specific dose no longer allows you to achieve a previous high. So long story short, you need more and more of the drug to achieve whatever high you're trying to get. That's tolerance. We talked about withdrawal already, because when we talk about intoxication, the counterpoint is withdrawal, when a person stops using the drug. And there are a whole host of negative experiences. So one of the behavioral explanations of substance abuse and dependence is there's both positive and negative reinforcement. Positive reinforcement is the pleasant experiences during intoxication. The person feels good, they feel high, it feels good, right? But there's also negative reinforcement going on, because people continue to use the drug to avoid some of these unpleasant withdrawal effects. So the drug is reinforcing itself. Now, in order to be diagnosed with a substance use disorder, you have to track the substance of abuse for at least 12 months. Now, it's very important we understand that I'm going to go through a whole host of symptoms, but you only need 2 of them in order to be diagnosed with a substance use disorder, right? The more symptoms you have, the more severe the substance of abuse is, or the substance use disorder. So let's get into it. So one of the things we see is that the drug is oftentimes taken in larger amounts or over a longer period of time than is intended, right? So if we track a person and let's say they were on pain pills post-surgery, and the doctor says the person should be on these pain pills for 2 weeks, and then they're still on it a year later, even though they're not in pain directly due to whatever the surgery was, we would say that they continued the drug, and that would meet this criteria. Or in other cases where the person just increases the dose. So if a person was using heroin, and they would get high off of 1 bag of heroin, and then through time we start to see that they're needing 2 bags in a day or 3 bags in a day, that would suggest that they're using larger amounts of the drug. We also see either persistent desire to use the drug or an inability to cut down. Many people with addictions will report they tried to quit the drug, but they wound up coming back to it. So we see unsuccessful efforts to cut down the drug or control the drug use. We also see that a person's going to spend significant amount of time trying to either obtain, use, or recover from the drug's effects. When you think about how much time it takes to do this, we're talking hours. Think about it for a second. If a person needs to obtain the drug, they have to go hunting for the drug. Now, if you were to say, oh, a person might know exactly where to get it, they still have to travel to get that drug. Then there's the time to get high. And then most drugs will stay in your system for several hours. So there's a recovering from the drugs. So we have significant time used to try and deal with the drugs of abuse. We also have craving, right? So we see strong craving. Now, craving is a tricky one because even when a person is in recovery, we don't view craving in isolation as having the disorder, right? If you talk to people, it could be 12 years, 15 years, 20 years, and they might still have some desire to go back and, have a drink. Oh, I remember I used to have drinks, over fancy dinners, and they might reminisce about that. So the craving could pop up even 20 years later, but that's not enough to have a diagnosis. Now, we also have to have some level of dysfunction linked to the disorder. So we see that the recurrent use of the drug causes problems with day-to-day functioning, whether it be at work, school, or at home. So one of those life obligations or role obligations are not met. We also tend to see relational problems linked to substances of abuse. So believe it or not, the vast majority of domestic violence involves alcohol. So there might be a relational problem, romantic problem, familial problem linked to substance of abuse. You also see that recreational activities that one previously might have done or social activities, the person retreats from those activities or reduces those activities. And we also see them being willing to put themselves or other people in hazardous conditions. Now, we defined the idea of craving, we defined the idea of tolerance, and we defined the idea of withdrawal. But in the DSM, there are specific things we're looking for, right? So the craving is might be linked to some kind of using of the drug, even though there's some kind of problem linked to it. So the craving forces that. Tolerance, we said, I define this as either needing increased amount of drug to achieve a previous high or desired effect, or a general diminished effect of the same amount of a drug. So either of these are going to be a good indicator of tolerance. Withdrawal could be linked to a specific characteristic of withdrawal symptoms, or a person could continue to use the drug to avoid those symptoms, right? So that's the DSM. Now, we also want to use specifiers, right? So if a person stopped using a drug, we would use a specifier in early remission if it's been at least 3 months since their last use of the drug, but still less than 12 months. We would use the sustained remission if they hit a year or longer. Now, remission is basically they're sober, they're not using the drug anymore and whatnot. Does that mean that they don't have cravings for the drugs even while they're sober? Of course they can have cravings, but you need more than that. Now, we also talk about when a person is no longer using drugs, but it's due to being in a controlled environment. So you might hear of detox centers or rehabs. So if a person is in detox or a rehab, we would specify that they're in a controlled environment. Now, we went through the whole list of symptoms one can have and the checklist. We have to also identify the level of severity of the substance use disorder. Mild would be anytime there's 2 to 3 symptoms. Moderate would be 4 to 5 symptoms, and severe would be 6 plus, right? So each substance of abuse is going to have its own specifiers and severity. Now, currently, I've been talking about substance use disorders in general terms. But when you diagnose a person with a use disorder, it is going to be more specific. So let's say a person is has some kind of addiction to alcohol. What we would use is the diagnosis alcohol use disorder. And let's say this person had a DUI and now has some ankle bracelet, and the court is monitoring whether they're drinking, right? So they said they have to wear an ankle bracelet for 6 months. Let's say that after the DUI, 3 months have passed. We might label that as an alcohol use disorder in early remission. So we're acknowledging that they've been sober. It is not in a controlled environment because they still have access to alcohol. They still have to choose not to do it. Whereas if the person was 3 months clean and sober, but it was because they were sent to a rehabilitation center, at that point, we would say an alcohol use disorder in a controlled environment. Am I making sense, or does that make sense? So I just wanted to give you how it would look with different conditions. So if we were to look at substances of abuse, we know that roughly 7% of adults in the United States show some form of substance abuse or dependence. However, only 20% of people who have a substance-related disorder are actually seeking treatment. And that is concerning when you think about it, right? Because there is a lot of people are just struggling or suffering in silence when they could get better. Now, I mentioned to you drugs. There are different kinds of drugs. So we can classify drugs as either naturally occurring or lab produced. When we talk about drugs as naturally occurring, that would be what you would call organic, right? So things like marijuana is organic. It grows on a tree. Cocaine is organic. It grows from a coca plant. Heroin, or more specifically, opium, is organic, right? All of these drugs are organic. And I'm intentionally using the word organic because it just means naturally occurring. And people will slap a label organic to imply it's better or healthier. But when it comes to drugs of abuse, whether it's organic or not, it's still a problem. Now, we also have lab-produced drugs. So methadone is a synthetic opiate, which was designed to be a replacement drug for heroin. It reduces the risk of sharing needles and injectables, things of that nature, and it stays in your system for 24 hours. So the half-life is much greater or longer than heroin. So that's a lab-produced drug. We also can talk about drugs as being legal with or without a prescription. So we talked about tobacco and alcohol and caffeine. All of these drugs you can go to a store and buy. You don't need a doctor to prescribe it. Whereas something like Percocet, you need a prescription for. So these are all legal. some with and some without a prescription. And then, as I said, some drugs are considered illegal in all circumstances, like heroin. So when we classify drugs, we have to have some kind of concept of that. Now, these drugs are available in our society to greater or lesser degree. And I'm going to tell you a general principle. The drugs that are more available in society and have the fewer restrictions on them have the greatest abuse rates. So that's something to think about, right? So alcohol and tobacco products have significant abuse potential, and the fatalities attached to these drugs in particular are pretty significant. Now, cannabis is a tricky one because on the federal level, cannabis is listed by the DEA as a Schedule I drug, which would make it illegal, even though there are some states that have it as legal. And with the legalization of cannabis, the rates of cannabis use has gone up, and the rates of cannabis use disorder has gone up. So if we were to look at the impact of availability, we estimate that nearly 28 million people in the United States have used an illegal substance in the past year. And we estimate that about 16 million people are currently on them. Now, what is concerning is that we estimate that 1 out of 4 high school seniors has used an illegal drug in the past month. Now, I would argue, to push back on that statistic, though, if you look at the data, they're still counting cannabis as an illegal drug, and our high school seniors are predominantly using alcohol, tobacco, and cannabis. So something to think about. Not that there aren't using other things, but the vast majority of substance abuse is alcohol, tobacco, and cannabis. An interesting finding, though, is that the rate of cannabis use is going up and the rate of tobacco products is going down. So that's a trend that we're noticing. So we are going to go through various categories of drugs or that you can abuse. We're going to classify things as either depressants, stimulants, hallucinogens, and then we're going to talk about cannabis as its own category, and then we'll talk about poly drug use. So when I say a depressant, I'm referring to a drug that slows down the central nervous system. So it's what we call a CNS depressant, right? So it slows down the nervous system, whereas stimulants excite the central nervous system. Hallucinogens require some perceptual disturbance, whether it be hallucinations, delusions. A common one can be paranoia, things like that. Cannabis has, we refer to it as the all-arounder drug because it has both depressant, stimulant, and hallucinogenic properties, depending on the ratio of THC to CBD. It can have different properties. And then we talk about poly substance use or poly drug use when a person is using more than one substance at a time. Now I'm going to stop the recording here because I want to contain the different categories of substances by themselves.